morning. Last night I announced new mandatory province-wide restrictions necessary to keep our hospitals from being overwhelmed. Today we're here to review the details of these measures and announce a big and very exciting step forward in our vaccine rollout. The restrictions that I announced last night are tough, but they are absolutely necessary to stop the spike of the third wave of COVID-19 and to ease the strain on our overburdened healthcare system. We must act to bend the curve down one last time. Minister Shandro will provide a recap on those restrictions shortly. The good news is that we have vaccines on our side. As I said last night, they're already working wonders and they're finally arriving in larger volumes, larger doses. Today, I am pleased to announce that by this coming Monday, every single Albertan over the age of 12 will be eligible to receive a COVID-19 vaccine. This reflects late-breaking news this morning from Health Canada that the Pfizer vaccine is safe for children at 12 years of age and older, which is obviously great news. This is a major milestone in our vaccine rollout, and it comes right when we need it most. When vaccines started trickling into Alberta just before Christmas, we had this day in mind. The day that we knew we could begin vaccinating pretty much everyone. It's been a long road, and I want to thank Albertans for their patience. While we know that every single person can benefit from this vaccine, our priority has always been protecting those at highest risk first. Now that those at the highest risk of experiencing severe outcomes from the virus have had the opportunity to receive their first dose, we can offer a vaccine to all Albertans. We're doing this in two steps to avoid overloading our booking system. We'll begin by opening up vaccine bookings to all Albertans age 30 and older. And starting tomorrow, Albertans born in 1991 or earlier will be able to book their appointments through AHS or pharmacies across the province. Then, on Monday, the 10th of May, we'll open up bookings to the remaining folks in Phase 3 from ages 12 to 29 or those born between 2009 and 1992. Again, we are staggering this phase into two age groups just to protect the booking system and so it doesn't get overwhelmed and minimize frustration of Albertans who've been patiently waiting their turn to roll up their sleeve for their first dose. Because if we have upwards of a couple of million people trying to book at the same time, obviously that would create a lot of frustration. With this, another 1.3 million Albertans are now eligible for the vaccine. Outside of the Northern Territories, Alberta is the first province to offer vaccine to everybody 12 years of age and older, no matter where they live or what medical conditions they might have. This is a testament to the efficiency of our vaccine program and Alberta's determination to get vaccines into the arms of people as quick as we can. If we receive the supply that we've been promised, we expect to complete this entire phase by the end of June and hopefully sooner than that. This will go a long way to boosting the level of protection for every Albertan choosing to be immunized. Many people who have made significant sacrifices throughout the pandemic will now get their turn. And I'm hopeful that by making COVID-19 vaccines available to everyone 12 years of age and older, we'll see a high uptake from everyone right across the province. By booking an appointment and rolling up your sleeve to get a COVID-19 vaccine, you take us one step closer to that reality. I want to close by thanking the thousands of people who are working day in and day out on the rollout of the vaccines. Despite the supply challenges and setbacks that we faced, our teams at the Department of Health, Alberta Health Services, physician and pharmacy partners, and our provincial COVID-19 vaccine task force, well, they've all developed and implemented an efficient, effective, and scalable model to get doses into the arms of people as quick as possible. And community pharmacies who are the face of this program. From the people who are booking appointments and administering the vaccines to those completing every task in between, thank you. We are grateful for your efforts in protecting Albertans from the pandemic. Together, we will get through this. If we follow the public health measures that are in place and we all get vaccinated as soon as we can. Thank you. And with that, I'm going to turn it over to Minister Shandro to talk about the additional public health measures. And I believe we'll also be joined by Minister Madu to talk about additional enforcement measures. And I believe as well Minister LaGrange to talk about the difficult decisions with respect to in-classroom instruction.
Thank you, and good morning, everyone. I'd like to begin my remarks this morning by acknowledging the death of an Albertan due to a rare blood clotting condition that is linked to the AstraZeneca vaccine. My thoughts are with the patient's family and all of her loved ones. It's a tragedy for them, and I realize that it may be a shock to anyone who has been vaccinated or is thinking about it. So because of that, it's important to be clear that this does not change the relative risks of vaccination or the message that people need to get vaccinated. And with the risks from COVID as high as they currently are, the best vaccine is the one that's available right now to anyone and everyone who is eligible. I should also note that there are risks of blood clots when contracting COVID, and those risks are higher than the risk from a blood clot from a recombinant vaccine like the Covishield or AstraZeneca vaccines. Now, I realize that people may have questions, so if you do, please talk to a doctor or other healthcare professional. It's your decision, just like it was my own when I received the AstraZeneca vaccine. But I expect that people will decide that it's the right choice for them. I'd now like to provide a quick recap on the new restrictions that Premier was just now speaking about. These measures, many of which take effect today, are tough, and they are absolutely necessary. We need to get this wave of COVID cases under control once and for all and ease the strain on our healthcare system. As Premier said last night, we've seen cases rise significantly in recent days. And last week, we set a record for ICU admissions. On March 5th, which is just 2 months ago, we had about 4,700 active cases. Today, there are almost 24,000. We know that hospital capacity will get even more strained in the next few weeks. We need to take action to bend the curve back down one last time. And that's why, except for a few areas with very low transmission in the province, all outside social gatherings are now limited to 5 people or less. Indoor social gatherings are still prohibited. All post-secondary institutions are going online only. Funeral services are limited to 10 people, including participants and guests. Receptions remain prohibited. All indoor fitness is prohibited, and all post-secondary institutions will go online only. Any workplace where a transmission leads to 3 or more cases will also be required to close for 10 days, except for situations where a closure would be against the public interest. All K-12 schools province-wide will shift to online learning from May 7th through to the 25th. And as Premier said, our colleague, the Minister of Education, Minister LaGrange, will have more to say on that in a moment. And starting at 11:59 p.m. on Sunday, patio and outdoor dining must stop at all restaurants, all bars, and all cafes. All personal wellness services, and that includes hair salons, barbers, and estheticians, must also close. All outdoor sports and recreation will also be prohibited, except with members of your own household, or if you are someone who lives alone, your 2 close contacts. Now, these measures apply to any region or community except for those with fewer than 50 cases per 100,000 people and fewer than 30 total active cases. For those few communities throughout the province, they will revert back to step 0 restrictions. So they will have more restrictions imposed on them as well, but fewer than the other ones that I previously announced. Now, in these communities, in these areas, schools will still shift to online learning, and patios must still close on Sunday, evening. Indoor fitness and youth sport or performance activities must also stop. However, they will be allowed to have gatherings of up to 10 people outdoors, up to 20 people at funerals, and continue offering haircuts and other personal and wellness services by appointment only. Now, all of these new restrictions will be in place for at least 3 weeks, except for schools. And they will work. We bent the curve in December, and we can bend it one last time again here in Alberta. Combined with the massive expansion of our vaccine rollout that Premier just announced, these measures will help us bend down the curve and get to the end of the pandemic. I know that Albertans are tired, including everyone who's followed the rules and worked to stop the spread. But if we all work together to embrace these restrictions, we will get this final wave of COVID under control. So thank you to all Albertans for doing your part in the weeks ahead. I'll now invite Minister LaGrange to provide more information on the shift to online learning. Minister LaGrange.
Thank you, and good morning, everyone. As you know, yesterday we announced that all kindergarten to grade 12 students will move to at-home learning starting this Friday, May 7th. They will return to school after the long weekend on May 25th. This is for all students across the province, regardless of whether they are in a hotspot region or not. I know this is very difficult news to hear for many students, for many parents, for teachers, and for other staff. Over the last week or so, we have been seeing an increasing number of COVID cases in the province, which is reflected within our schools. Over the last 10 days in particular, the last 4 days, the number of students and staff quarantining, shortages of substitute teachers, and requests from schools to shift to at-home learning have all increased substantially. We had all hoped that this type of a shift was behind us. However, we must take on one more reset to stop the spike and protect our healthcare system. I want to be clear that schools remain safe places for learning, and we will all get back to in-class learning as soon as it is absolutely possible. However, the operational stresses on the education system need to be addressed, given that provincial community spread continues to climb, and we know that cases in schools are a further reflection of what is happening in our community. While difficult, there are some positives to this shift. It will help minimize the learning loss that's been happening due to the absences from COVID-positive cases and the requiring quarantining that has to take place after that. It will also help our older students who are working to meet academic requirements for post-secondary education by minimizing their moves from in-class to quarantine. This approach also means consistency throughout the province and minimizes confusion for parents across various regions. And it also allows our teachers and support staff to access vaccinations that were announced earlier this week and the expansion that we've heard just today. I would also like to highlight that exceptions will continue to be available for students with disabilities so that they can continue to attend in-person classes similar to what has occurred before. To be clear about at-home learning, it is just that, learning at home. School divisions will work with their families to ensure that learning will continue and that the needs of their students are met. We know that at-home learning is especially difficult for younger students, and we do not want to overburden families during this difficult time. That is why we are going to ask school divisions to focus instruction on fundamentals like literacy and numeracy for grades K to 6. And for grades 7 to 12, little changes for most students, as many are already learning at home, particularly if they have been in a hotspot region. What will change is their return to classroom date. Learning expectations for grades 7 to 12 will continue to be equivalent to regular in-school classes. I do want to acknowledge the tremendous impact these changes will have on all parents, particularly those with younger children. I understand that this may require adjustments to schedules and creative solutions for some families. I truly hope that this is the last time that we will be in this situation, which is another reason why it is so important, so very, very important right now for every Albertan to do their part to stop the spike. I want to end by thanking all teachers, school staff, parents, and of course our students for remaining flexible and for all of their efforts since the very start of this pandemic. While the situation right now is one that no one wants, I am confident this is a temporary shift for our schools and that we all can look forward to coming back to class in a few weeks. And I really want all of our students and our staff to be able to close out this school year in a very strong and positive note. So thank you all, and I now turn it over to my colleague, Minister Madu.
Thank you, and good morning. As my colleagues have explained, our government's goal throughout this pandemic has been to reduce the risk of COVID-19 transmission and keep Albertans safe, healthy, and alive. That mission remains unchanged with the implementation of new measures today. A public health crisis should never be used as an excuse for government to claim new powers or for law enforcement to flex its muscles indiscriminately. So let me be clear that Alberta's government is not doing either of these things today. Nevertheless, we need concrete action to address the ongoing and escalating threat to public health and the strain on our healthcare system being posed by those who continue to defy our efforts to reduce the spread of COVID-19. And while most Albertans have understood this threat, made the personal sacrifices we've asked of them, and often gone above and beyond to comply with these restrictions, it's become clear that there are a small few who refuse to comply with reasonable and legitimate public health orders. As Minister of Justice and Solicitor General, it troubles me to see the rule of law being eroded in this way. Action must be taken, and action we are taking. First, fines for Public Health Act violations are doubling from $1,000 to $2,000. It reflects the serious risk non-compliance poses to public health and safety. An order in council to this effect will be passed as soon as possible. But let me be clear, fines alone will not eradicate the problem of repeat offenders. And so we are also introducing a new enforcement protocol to more effectively target complex and flagrant cases of non-compliance. Whether an individual, organization, or business is the culprit, this protocol will be used to coordinate a multi-agency response to repeat offenders. It will draw upon the expertise of local police services as well as Alberta Health Services, Alberta Gaming, Liquor and Cannabis, Alberta Prosecution Service, and Occupational Health and Safety. Representatives from these agencies will coordinate plans tailored to review and address the particular circumstances of each case of non-compliance. Some cases may require further investigation, and some may trigger various enforcement powers, such as fines or revoking of licenses. To be clear, each agency will continue to act with its own mandate and the scope of its existing powers. But by sharing information and discussing enforcement actions this way, on top of doubling the fines, that public health orders will be enforced more effectively and consistently than before. This protocol is establishing coordination and accountability between the partner agencies to quickly and effectively resolve incidents. Through it, we establish scope, standards, and roles across the partner agencies. It also strikes a balance between the obligations of each agency to their partners and respective agencies. Enforcement will be done, and Albertans will see it being done. Let me close by thanking all law enforcement men and women and frontline staff across our province who have worked diligently over this period to ensure that we keep Albertans safe. Let me also note that we also have Dr. Dina Hinshaw, the Chief Medical Officer of Health, with us today for any questions. Thank you. And with that, we will now take questions.
So now we'll go to the phones for questions. We'll do 2 questions each, 1 question, 1 follow-up, or 2 off the top. And as Minister Madu mentioned, Dr. Hinshaw is also available for questions today. Operator, can you please put through our first caller?
Eloise Starin, Global.
Good morning. I have a 2-part question for Justice Minister Madu. The Lethbridge mayor recently said the province told city officials not to issue too many tickets to avoid bogging down the courts. So my questions are, why was that messaging given to municipalities? Wouldn't that seem to discourage enforcement? And has that messaging changed? What is the messaging today? And are you still worried about enforcement impacting the courts?
You know, so quite frankly, I have no idea where that is coming from. I can assure that I have not directed any local law enforcement or police services to not enforce the public health orders or to issue tickets. And so my direction from the get-go has always been that law enforcement across our province have got the tools and the power to enforce the public health orders and to keep the peace. You know, I think it's important to say that whilst it is true that I am the Justice Minister and Solicitor General, I do not on a day-to-day basis direct how law enforcement is to do their work. Either do I direct the Crown Prosecution Service on how to prosecute. There are prosecutorial and law enforcement independence and discretion with the manner with which they carry out their jobs. But to be blunt, I have been clear from day one that it is my expectation that law enforcement and the Crown Prosecution Service will deploy all tools available to them to ensure that the public health orders are enforced. So in a nutshell, I have no idea where that information is coming from.
Do you have a follow-up?
Just that, you know, what is the enforcement message today at all? You know, what should municipalities really be doing?
So we have put forward a new law enforcement protocol that includes all of partner agencies, from local law enforcement to the RCMP, to Alberta Health Services, to Occupational Health and Safety. My expectation, again, is that all of these agencies will work together to ensure compliance. And my message to local authorities is work with your local law enforcement and local Alberta Health Services inspectors, you know, to ensure that problematic cases of non-compliance are reported and that you know, efforts are taken to ensure compliance.
And perhaps I'll just add as well. Thank you, Minister, for that. You got it exactly right, Minister. I would also add that the message is that it's a multi-agency collaboration. All of the agencies that are involved in enforcement have been working collaboratively throughout the pandemic, and we need to continue with that collaboration. So thank you to all of them. This isn't easy. But we're not the only jurisdiction going through these tough decisions and requiring this tough collaboration. We need this collaboration to continue Thank you to the municipalities. Thank you to our police services. And thank you to AHS for all working together to be able to resolve these difficult decisions that need to be made regarding enforcement.
Operator, can you please put through our next caller?
Rick Bell, Calgary Sun.
Good morning, Premier. It's a question for you, and good morning to the ministers. You've talked a lot about, vaccine rollout and the fact that the vaccines will do their work and help push down these numbers in a couple of weeks or a few weeks. So could you tell me, a lot of people I think want to know this, truthfully, right now, right at this very moment, how close are we? How much of a chance is there really of having an actual overwhelming of the healthcare system in the next, let's say, 2 weeks or 3 weeks or, 4 weeks, when eventually, of course, the vaccinations will help a whole lot. So how close to, everybody talks about this overwhelming of the healthcare system, how close are we to that that overwhelming where doctors will decide who lives and who dies, and there'll be field hospitals, and there'll be no room in the hospitals, and we'll be at 2,200 beds and all the rest of it? And then I'll have a follow-up.
Sure. The answer, Rick, based on current trends, would be about a month from now. We right now have, let me walk you through it, 150 COVID patients in ICU beds. We have another 60 non-COVID ICU patients, so 210. On a typical day in a non-COVID year, we would have about 190 staffed ICU beds across our 100 hospitals in Alberta. We've already exceeded the normal state maximum capacity of ICUs. Of course, we've worked, the AHS has worked very hard, the government has provided enormous funding, and our frontline workers have done an amazing job to expand that capacity. So we can manage the current load and what's coming at us, but not if the numbers continue to go up, particularly not if the growth of the spread of the virus accelerates. Right now, we're growing at 1.8% a day. And that would take us to 30,000 total active cases by the middle of May. It would take us to 40,000 active cases by the end of the month. When you take that number and apply the ratio of cases to hospitalizations, you end up moving into the red zone in terms of ICU capacity of well over 300 ICU patients with COVID in early June. And look, our stretch capacity is, I'm trying to be very specific with you here, so there's no BS involved in this. Our stretch capacity is 425 COVID ICU beds. But let's be clear, we can only open up those beds, those staffed beds, by massively canceling surgeries and other healthcare procedures, the costs of which would be very high and frankly would also likely cost lives. So if growth, bottom line is this, based on current trends, and this is not, by the way, this is not modeling, this is not, the only assumption that I'm making in answering your question is that the trends continue in their current direction. If we continue to experience 1.8% daily growth in cases, as we've have over the past few days, then we move into the red zone, I would call it, for ICU in early June. But here's the concerning thing. The speed of viral spread has been increasing. If it continues to increase, if we go from 1.8% daily growth to 3% daily growth, then we move into the red zone earlier. We had 40,000 active cases earlier, and then we end up potentially, as I say, in about a month, having to exercise triage protocols in the intensive care. Now, maybe this is too much information, but I'll just add one more bit of context. What we hope will happen is that the case to hospitalization ratio will continue gradually to come down as more people likely to get sick are vaccinated. That's on the hopeful side. But on the unhopeful side is the impact of the variants. And the P1 Brazilian variant in particular, because there is some evidence that the vaccines are less effective against the P1 and that it pierces natural immunity from antibodies acquired through prior infection. So that gives you the best picture I can give you.
And your follow-up, Rick?
Yes. So if the situation is so dire, or could be so dire, and surely I am not advocating this position, I'm just asking the question because you painted a pretty potentially very, very bleak and quite immediate picture. What are you prepared to do to make sure we don't get to the red zone, or what you see as the red zone? And maybe, I know this is like a third question, but could you just explain a little bit what the red zone is? But what are you prepared to do if the situation becomes as bleak as you say? And could you just give sort of a definition of what the red zone is as well? Thank you very much.
It's a phrase I use basically to say being in a position which is approaching total maximum capacity. The red zone is where we have to do mass cancellations of surgeries. Right now, we've already authorized up to 30% cancellation of a maximum of 30% of surgeries in health zones where necessary to deal with the stress that the system is currently under. But it would have to be the vast majority of surgeries would have to be canceled in the red zone. And that's a situation where we might have to begin moving patients into overflow medical support, like the sprung structures here in Calgary, the ambulatory hospital that they set up, the Butter Dome in Edmonton. The red zone is essentially where we are beginning to approach, like we're within 80%, we're within 20%, I should say, of approaching a total maximum capacity. Let me emphasize, like we're not telling people this to create unnecessary fear. We're just trying to be straight up with Albertans about where we're at. And we can cope with the current situation, not easily. And I have to salute the ICU nurses, and docs, and the respiratory therapists who are, many of whom are exhausted, especially in the large Edmonton, Calgary hospitals where they've been working overtime shifts now, often for much of the last year. But we can manage right now. HS has worked very hard over the past year to increase capacity, do everything we can. But people need to know that there is a limit. Now, some folks say to us, well, why didn't you create more ICU capacity, more hospital space? A couple of things on this. We actually have created overflow space, but the issue is not so much physical space. We can always set up extra hospital beds, and we've got tons of PPE, we've got lots of ventilators and equipment. The issue is people, and there is always going to be a finite number of folks who can actually care for ICU patients with a severe respiratory disease of this nature, anesthesiologists, respiratory therapists, and of course ICU nurses who can participate in things like intubation for COVID patients, hooking them up to ventilators, for example. We have sought to accelerate the certification of new graduates from those programs and bring retired people back and move part-time people to full-time. But every other jurisdiction, it's not like we can go out in the market and just recruit a bunch more folks when everywhere else in North America has been looking for the same skill set. And people say to me, well, how come Texas can, the U.S. states can manage this? Well, Medicare, healthcare is big business down in the States. They spend about a third more than Canada does on healthcare, and they have significantly more capacity. I'm told Texas has, for example, 7,000 fully staffed ICU beds. In a normal year, we would have 200 in Alberta. They have 29 million people. We have 4.5 million. That just gives you a relative sense of capacity.
Operator, can you please put through our next caller?
Kevin Nimick, CTV.
Hi, Premier. Yesterday you spoke about threats you and your mother have received. Are you receiving additional protection or security for these threats?
I don't comment on security matters. In fact, I don't get informed by the Sheriff's Service. I try to keep that to them. But all I can tell you is that I've clearly been receiving more threats of that nature, and I'm not the only person in government that has been. This is, look, I understand COVID fatigue and frustration, and I sure understand people who disagree with policy, but lashing out with violent threats against anybody is always wrong, and I just hope that that people who are that passionate about things just take time to cool down and realize that they're not doing themselves or our province any service by making threats of that nature.
And do you have a follow-up, Kevin?
I do. Premier, businesses we've spoken to so far say they're fine with closing for the greater public health good, but they need more financial help from the province. Will you provide additional money for Alberta businesses?
Well, we are right now. Of course, we're rolling out the third installment of the small and medium-sized enterprise relaunch grant, an additional $10,000 for businesses that have experienced at least a 30% decline in their revenues over the past year. And so that represents an additional $350 million in direct support. That'll push us over well over $1 billion in total direct cash support for SMEs, small businesses that are impacted. And in addition to that, we've provided over $1 billion of support through things like covering WCB premiums for small businesses, covering the hotel tax for hotels in most of the past year, and many other programs. We've participated with the Government of Canada in the commercial rent assistance program. That was several $100 million. And of course, we've also participated in the critical worker benefit, which has helped people, workers of many of those businesses. So we'll look at whether we need to do anything additional. My hope is that if people really get the message here and act responsibly, that this really hopefully can be a short-term, last-time set of public health restrictions, and those businesses can get back, hopefully, to a decent summer. That is our hope, and the vaccines are on our side in getting there.
Operator, can you please put through our next caller?
Julia Wong, Global News.
Hi, this question is for the Premier. So these restrictions will be in place for at least 3 weeks. What happens after that? Is there a plan for reopening, and how are you going to clearly define what are safe levels, case rates, positivity rates, that type of thing for reopening?
Thank you. We haven't defined particular metrics for relaxing the measures. The key thing I'm looking for is to see the numbers, first of all, start to flatline and then come down. And I think if we can start to see a period of sustained decline in our average daily new cases and in the total active case count, that will be a strong indication that we can begin moving towards relaxing some of these measures because of the vaccine. I mean, when we were earlier in the pandemic, we were kind of on a tightrope without a net. The vaccine is our net now. And so I think when we believe it's prudent to move forward with reopening, we will do so knowing that the vaccine is helping to interrupt chains of transmission and also keep people out of hospitals. At the end of the day, the key thing for us is never been COVID zero. It's been keeping people, preventing the hospital system from being overwhelmed. And right now we are at about a third of population that has had at least one jab. About 40% of the adult population. We anticipate receiving another 1 million doses of vaccines through the month of May. And so with the opening of that we've announced today of the vaccine rollout to phase 3, basically the entire general population, I would estimate that about a month from now, we should be at approaching potentially 2/3 of the adult population having been vaccinated. So I really hope that will begin to have a real impact on the spread of the virus. So all of these things are interplaying, plus the variants are in the background. So we just can't make a hard and fast prediction about relaxations. I would just point, though, to other provinces. Other provinces generally are seeing their numbers come down, and including provinces that have had less stringent restrictions than Alberta has today, like Saskatchewan and BC. What's driving those numbers down? I would say it's cumulatively the effect of the vaccines.
Julia, do you have a follow-up?
Actually, Saskatchewan, sorry, Julia, just one note of interest. I see the government of Saskatchewan released a very interesting framework, I think, for three steps towards lifting public health measures based on the percentage of population that has been vaccinated. They just released that yesterday, and that's something we'll take a look at as well.
Follow-up, Julia?
Yes, thank you so much. My follow-up is for the Premier and for the Justice Minister. You talk about more enforcement. You talk about how there will be a stricter approach to this. A major protest is planned for Mayor this weekend. The enforcement strategy to this point has not prevented major events like this, such as the rodeo in Bowdoin last weekend. So are there new measures in place to deal with these types of events? I guess more specifically, will there be a proactive approach rather than a reactive approach?
Well, all I can say is, sorry, Kaycee, I'll let you jump in after here, but there is an agreement that we've referred to, this new protocol, where all of the relevant agencies have agreed to collaborate on focusing on serious repeat violators of the public health orders, and also to be more proactive. There are tools that can be used if those agencies believe it's prudent to do so. For example, to seek court orders under Section 66.3 of the Public Health Act in anticipation, potentially, of events of that nature. So, again, not for the ministers or me to pick up the phone and call the Crown prosecutors or the enforcement agents to instruct them to make an application. That would be a violation of the independence of those agencies, but we have highlighted to them that they can, and if their judgment they should, use those tools.
No, and Premier, if I may, and I think the Premier is correct. That is why we have put in place this new law enforcement protocol, so that all of the agencies that deals with law enforcement with respect to the public health measures can work together, to review where all these, threats of non-compliance are coming from, and make an informed determination and decision on how best to proceed. I am confident that with the new protocol that we've put in place, you are going to see more proactive response to incidents that you have described.
Operator, can you please put through our next caller?
Janet French, CBC.
Hi there. Thanks for taking my question. It's for the Premier. I just have a question about your turn off the taps legislation. I'm curious why you would proclaim that law, then have the government defend that law in court, and then allow it to expire.
Very simply, we were waiting to see the outcome of the Federal Court of Appeal litigation before deciding how to proceed. We thought it was our best litigation strategy, and also to be respectful to the court, to wait and see and take on board their decision. As you know, it was a 3-1 victory for Alberta in that respect, and so we will be renewing the legislation. We also wanted to see if the court was, in their comments, in their judgment, would make comments that could be helpful in improving the legislation. And so we'll be taking on board both the decision of the federal court itself and the Federal Court of Appeal in making some minor revisions to that law. So I think the fact that we proclaimed it, brought it into force, is the very first act of our government. The day that we were sworn in has proven to be the right decision. British Columbia has down tools in its earlier effort to hinder the construction of the Trans Mountain expansion. And in fact, I want to give a word of appreciation to the Premier and Government of British Columbia for issuing provincial permits where necessary to facilitate TMX construction. Nevertheless, we believe that that legislation is an important strategic tool that allows Alberta in different potential circumstances to defend the value of our natural resources. So we will be bringing that legislation back in, and we'll be making some minor revisions to it.
Follow-up, Janet?
Yeah, I'm just curious, and your energy minister said as well that the court challenge allowed, room for improvement for this law, but why do you need a law at all if BC is not resisting TMX, if that's not an obstacle anymore?
Well, we need this law for the same reason that Peter Lougheed threatened to turn off the taps during the National Energy Program. That is partly what brought the federal government to the table to undo some of the damage of the NEP 40 years ago. And we don't know what other kind of circumstances we may be facing in the future. So I think it's useful to have a lot of different tools in our toolkit to defend our vital economic interests. And this is one that cuts across the partisan spectrum in Alberta. It was the previous government that brought this in with our strong support. We thought it was insincere of them to bring in the law, but not to proclaim it and to make it effective. We've done that. We've now won in the courts against all sorts of predictions that we would lose, and so I think it's been validated, and particularly the cooperation of BC on this has validated that Alberta is taking the right approach.
Operator, can you please put through our next caller?
Kelly Kreiderman, Globe and Mail.
Hi there. Good morning. Premier, it's no secret that members of your caucus have been vocal behind closed doors and in public about public health restrictions. Did that play into your decision to not impose more strict health restrictions until now?
No, Kelly. Whenever I chair our Emergency Management Cabinet Committee, and once we receive the Department of Health's recommendations, usually the first thing I say is that we cannot allow political considerations to drive the decisions that we make. We do, however, obviously have to be mindful of the broader context of public opinion in Alberta about people's willingness to comply with the rules. As I've said repeatedly, there's no point in adopting a policy that will only invite widespread non-compliance. So and in that respect, we listen to representatives of Albertans, elected representatives. They have every right to speak their minds, to represent their constituents. That's their job, and it's the job of cabinet ministers as the government to actually make those decisions, those tough decisions. Kelly, if we were setting our policy based on what the opponents of public health measures think, we wouldn't have any measures in place. We have taken, and I do think there has been a tendency in the commentary about Alberta's approach to minimize or to understate the rigor of the public health measures that we have had in place for a very long time. For goodness sakes, it has been basically illegal for grandparents to visit their grandkids in a different household for 5 months. Thousands of businesses have been completely shut, for example, in the entertainment sector now, for 14 months. These restrictions, there's been a mandatory mask mandate in Alberta in place for going on 6 months. These are rigorous restrictions. We have to be mindful of the fact that a lot of people are sick and tired of it. But like I said last night, we have no tools left to prevent a worst case scenario in the healthcare system apart from these additional measures that we have taken. So again, we we take on board what people have to say, including MLAs, but ultimately we have to make what we think is the right decision with public health being the top priority.
And do you have a follow-up, Kelly?
Yes, Premier, you yourself have talked many times about how Alberta's health restrictions actually have been light compared to other jurisdictions. So I don't know how that matches with talk of how our restrictions have been tough. I'm also wondering how you can set parameters in place for the restrictions being in place for 2 to 3 weeks when you do not know what indicators necessarily will lead to them being lifted, and you don't know exactly when case counts will drop.
Well, we've set a minimum of 3 weeks. So in the case of the schools, first of all, that's a different kettle of fish, because the 2-week reset in the schools is being driven by operational issues and much less so the public health issues. So we have 80,000 people, students, teachers, and staff, who currently are in self-isolation. With the current increase in cases, that number will only go up, and the Department of Education, based on consultations with superintendents and school boards, believes that it will very soon become practically impossible to operate many schools with so many people in self-isolation. So they believe the prudent thing to do in order to save the rest of the school year is to hit the reset button for a couple of weeks. That is a very clearly defined limited period. With respect to the other measures, we're saying a minimum of 3 weeks. We will come back and reassess at that point. And as I said in response to an earlier question, the key thing that we are following is average new daily cases and the total active case count. Because if in those 3 weeks we can see those numbers stabilize and begin to come down, then we can begin to consider gradually relaxing restrictions as we head into the summer. So, you know, my view on this, if you look at other Canadian provinces and certainly U.S. states, European countries with comparable levels of vaccine coverage, many of them have seen numbers really start to fall dramatically when they got to 50% of the population vaccinated. And we will surpass 50% of the population vaccinated by the end of this month. So if we can just suppress the current spike, stop the spike, then I think we can let the vaccines will take over. That is certainly our hope and expectation.
Operator, can you please put through our next caller?
Tom Ross, 660 News.
Hi, I'm curious what changed in the past 12 hours or so since last night that made you so confident that vaccinations can be rolled out to essentially the whole population in just the next few days?
Well, we have been planning to roll out phase 3 as soon as we have reached, we have assurances of adequate supply to do so. Look, we've clearly articulated 3 phases. The very elderly and those in long-term care, for example, people with advanced chronic conditions, then again, people who are older in the age spectrum, and then eventually the whole population. And we're just now at the point where we can confidently proceed to do that. I mean, we want to make sure that we don't end up sitting on vaccine doses in the freezers. So we have to calibrate the timing of opening phase 3 to a point where we see that phase 2 has largely been inoculated, and we're starting to ramp up inventories. So I don't know, Tyler, would you like to comment further on that?
Yeah, thanks, Tom. And just to reiterate how we make these decisions on when we open up bookings, when somebody's making a booking for an appointment for a vaccine, it's for a vaccine that hasn't come to Alberta yet. So what we do is we take the allocation table that we get from the National Operations Center from the federal government. It has a forecast of what our allotment as Alberta is going to be well past 28 days, but we look at the next 28 days. And we started allowing people to make those bookings then based on the vaccines we are told by the federal government we're going to be getting. So when you get that, you make that appointment, it's for a vaccine that hasn't gone here yet. It's not that we wait for the vaccine to get here and then we make people make an appointment and then we ship it out to them. We're getting those appointments for vaccines that haven't gone here yet. So it's looking at that allotment table, looking at the changes at the allotment table. We had, I think before today, about 470,000 appointments in the next 28 days, looking at the changes in the allotment table for Alberta and the increases in vaccines that we'll be getting for both the messenger RNA ones as well as the recombinant. We're expecting the ability to add those Albertans to allowing them to book those appointments now. Thanks, Tom. Yeah.
And sorry, Tom, you asked what's changed in the last 12 hours. Well, we wanted, first of all, to give teachers and education workers a chance to get their bookings in before opening up to the general population. So that announcement was made on Monday. We were actually ready to proceed with announcing phase 3 of the vaccine yesterday, but we decided it was more urgent to roll out the additional public health measures. And we didn't want the vaccine announcement to be lost in that mix. Now, so we are ready to proceed with phase 3, and we're giving people a heads up now to get ready to do their bookings.
And do you have a follow-up, Tom?
Yes, mostly directed to Minister Madu. When you talk about you don't know where it's coming from, where people say that, or where municipalities say that they're being told not to issue as many tickets, this is coming directly from police chiefs who say that their service is being told not to issue as many tickets. So somebody clearly isn't really telling the truth here. And when we see as well that the Crown has withdrawn 40% of Public Health Act tickets issued since last March, don't you think that really the province can do something more to step up enforcement? And again, if the police chiefs are saying that they're being directed not to issue as many tickets, are you implying that the police are lying?
So, let me be clear. The police chiefs across our province have got direct access to me, and we talk from time to time. In fact, earlier this week, I met with them, and none of them have said to me that they received a direction from myself or from my department to not enforce or to issue ticket. And so I am saying that I'm not sure where that is coming from, and that is simply the truth. And so, you would have to ask the chiefs to clarify where that is coming from. But I have not, as Justice Minister, directed my department or the chiefs to not issue ticket. I think that is as clear as I can be. With respect to what happens in court, again, I do not direct prosecution. Either do I direct what the judges or the justices of our court do in their courtrooms. The Alberta Crown Prosecution Service have all kinds of guidelines that they deploy in prosecuting ticket and other offenses. And so I leave that to them. But I have been clear that it is my expectation that tickets and charges that requires prosecution should be. There is a thin line to walk between myself as Justice Minister and what goes on the ground on a day-to-day basis with respect to how the prosecutors and the court do their work. It is regrettable that there have been cases being dropped and withdrawn, and we are looking at the reasons for that. And I think one of the things we've seen is this new enforcement protocol being put in place, plus my commitment, to continue to work with the Health Ministry and Alberta Health Services to see how we can beef up and close any loophole that is out there that is causing some of these, setbacks. So you have my commitment. It has been there from day one that law enforcement across our province have their direction to ensure that the public health measures are enforced and prosecuted.
Yeah, so if I could just add something to that, Kaycee. So, Tom, if that direction has come to police, it's quite possible it came from Crown prosecutors who don't consult with, and nor should they consult with the department or the minister. So I think just that's what the minister is saying, that it's possible to come from Crown prosecutors. They ultimately are in charge of managing the caseload and assessing chances of successful prosecution. And I can add that we've given the Department of Justice direction to hire more designated prosecutors to deal with public health offenses, and if necessary to look at hiring private sector law firms to supplement the workload.
Operator, can you please put through our next caller?
James Keller, Globe and Mail.
Hi, Premier. I just want to go back to Kelly's question on opposition within your caucus. I mean, you still have a sizable number of people in caucus who see all the data. They've heard all the warnings about the dire place the healthcare system is headed, rationing ICU care, and yet they're opposed to even the public health measures that were in place before now. So what do you think about just that exists within your caucus, and do you think it hurts the public health messaging and the buy-in that you need to have these new restrictions work?
Well, as I've said before, I don't think the fact that there is a debate undermines the seriousness of this matter. There's always going to be a debate in a democracy. I don't find a debate dangerous or threatening. I think there's always going to be a range of views about the best approach to COVID-19. But at the end of the day, the government is charged with the responsibility of making the tough decisions, because there's no shortage of critics out there, all kinds of different views. But at the end of the day, the government is responsible for the operation of our healthcare system, and we have to take the necessary measures to protect it and to protect human lives. So I don't find this I've made this point before, that in the United Kingdom you have about 80 members of the government caucus who have on multiple occasions voted against motions in the UK Parliament on the government's COVID restrictions. That hasn't stopped the United Kingdom from taking a very strong approach, doing what the government deems the best based on public health expert advice.
Do you have a follow-up, James?
Totally. I guess, like, if I'm living in Medicine Hat, I've got a popular local MLA who thinks this is all, overblown and we don't need these rules. I mean, surely that must have some effect on the public's willingness to follow the rules and comply, like you're pleading with them to do. So, like, what can you do to counter that if you've got, again, local leaders who carry a lot of sway in the community, who their message is that none of this is necessary?
Yeah. Well, what I can do is make the best decisions that the government can, or explain those to Albertans as best we can. And I don't think stifling, we've had medical doctors, a minority for sure, criticizing public health measures. We've had a number of mayors and town councils doing the same thing. That's what happens in a free society. But at the end of the day, I truly believe, James, and we've been tracking this very closely in polling, that the vast majority of Albertans may not like restrictions, but they understand the need for them, particularly in a context like this. The challenge it has always been throughout this that there is a small minority of the population who believes this thing is not real, and therefore the rules don't apply to them. And I would just say to them if they have a loved one who's waiting for surgery or who might need to show up at an emergency ward, they don't want that person being turned away. This is about more than just COVID. This is about the entire healthcare system. And so I just plead with people, come together for the next month as the vaccines increase their protective power. And if we just come together and be patient with each other for the next month, we can move past this.
Operator, can you please put through our next caller?
Dean Bennett, Canadian Press.
Oh, thanks very much. I think this is a question for Minister Madu. So you've said twice during this newser that you've been clear with police off the top, enforce the rules. Minister Shandro said that the organizations have been working hand in glove since day one. So I think Albertans would like to know, if that's the case, how did it happen that an advertised rodeo, super spreader rodeo, was allowed to take place? In your discussions with the RCMP and other officials, what have you learned, Minister?
So, great question, Jim. What I can say to you is that RCMP, local law enforcement, and Alberta Health Services collaborated on the rodeo that took place in Bowden. And ultimately, they made the decision at that point in time, and this is what I'm hearing after the fact, to not intervene whilst that particular event is going on, but to deploy intelligence so that they can follow up with the individuals involved in planning the event. I can tell you there is ongoing investigation with respect to that particular event. Again, I think the best way to explain it to Albertans is to say, at the end of the day, the laws are there, the tools are there, the resources are there, and we must trust the judgment of those in law enforcement and at Alberta Health Services, to whom we have entrusted with the responsibility to enforce and to ensure compliance. And if in their deliberations, taking into considerations all kinds of factors, made that particular call to go in a particular direction, my take is there must be a reason for that, despite the frustration, as frustrating as that can be. And so that investigation is ongoing right now, and my hope is that wherever that leads to, then the law will be brought to bear upon those who held that particular event in violation of the public health measures.
I would just add one point, which is I am aware that the RCMP and AHS approached a number of the organizations that initially were planning on hosting that. One or two of the Alberta Rodeo Associations, the local agricultural society in the area that was going to host this event at their rodeo grounds. And thanks to those interventions, they all decided to cancel and to pull out. I don't know why they ultimately didn't seek to bar access or apply for a court order, but we're making it clear that those tools are available to them.
And do you have a follow-up, Dean?
Thanks. Premier, on an unrelated matter, I haven't had a chance to ask you. So the legislature's not sitting for 2 weeks. Your government cited health reasons. Certainly that can be argued as a prudent measure. Yet you've made it clear in the past, of course, that it's important for symbolism for politicians to be in the House. The NDP said we could still be passing some COVID-related legislation. What was the reason behind that, and do you still not feel that it's important for politicians to be in the House?
Well, I absolutely do, and that's why Alberta's legislature has sat more than any legislature in Canada, including the federal parliament, over the past 14 months. We've sat more days and passed by far more laws, and we've demonstrated our willingness to continue doing the people's business and doing it safely. We thought it was important, however, at this critical moment, while we're hitting record high numbers in the province and asking people to make additional sacrifices, frankly, asking people to stay home wherever possible, that we lead by example. And that we not take the risk of bringing 87 people from across the province to travel. At this time, we've made a lot of progress. Frankly, one of the reasons we can do this now is because, unlike other legislatures, we didn't suspend sittings for months last year. And so we will come back. We'll spend as much time as we initially planned to. The opposition will have just as many opportunities to hold the government to account in question period. We've been able to pass the critical things for the spring session, including adopting the government budget, passing the estimates, moving forward on top priority legislation. So we felt that there was no urgent need to bring the legislature back at this critical moment. We could take a bit of a pause to show leadership by example. I'm doing most of my meetings from home by Zoom calls, and I just encourage anybody who's able to do that to do the same thing.
Operator, can you please put through our next caller?
Aaron Collins, CBC.
That's a question for the Premier, sort of following up on James and Kelly's questions. Some of your own MLAs have spoken out about restrictions in the past. Given the dire sort of circumstances that you've outlined here, I'm wondering if this happens again, if 17 MLAs speak out against these restrictions, are they going to be welcome in your caucus?
Again, I've been clear about the parameters that we will not tolerate people counseling fellow Albertans to violate the law, to engage in civil disobedience, or doing it themselves. The parameters are very clear. I can also say it's no secret that many of the rural members have asked for a more regional approach that reflects very low population density and very low case counts in some rural areas. And that was incorporated into yesterday's announcement in a way that I think is very prudent. And I'm sure that many of those MLAs in that respect will take yes for an answer.
Do you have a follow-up, Aaron?
Yeah, so you've talked a lot about wanting Albertans to step up to the plate here and try to follow the rules to bend the curve. It hasn't happened. And I guess my question for you is, to stick with the sports analogy, has a certain segment of Alberta's population, partly a segment of your base, dropped the ball by not following the rules? Have they prolonged this situation?
Look, I don't think it's about politics, but my reflection is that we've had pretty similar restrictions to our neighboring provinces. Their numbers are going down, ours are going up. And there can be a lot of reasons for that, but I think one is probably we have a larger share of people who are just not complying. But there's other factors, okay? So we have the youngest population in Canada, and COVID tends to spread more quickly amongst younger people. That's not blame, it's just a demographic fact. We also have a larger share of our population that goes to work every day, higher labor force participation rate, which means more people mixing with others. We've also had a pretty crappy spring weather, which isn't helpful. Places like Texas that have opened wide up have been helped by people being able to get outside. So I think there are a number of factors which may be behind what's going on here. But obviously compliance is a critical part of it. And that's why we sent the message we did last night with these additional measures.
Operator, can you please put through our next caller?
Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. I just wanted to clarify something. Is all of your caucus on board with these new restrictions?
Well, let me tell you, we have opportunities for members of government caucus to provide input on government policy. And there's never unanimity, but my understanding is that yesterday there was a broad reflection in our caucus of an understanding of the need for additional measures.
Do you have a follow-up, Carrie?
Right. I'm going to ask that question. Yes or no, is everybody on board with this?
I'm sure that amongst 62 MLAs, there are different opinions, but I was informed by the chairman of our member policy committee for health that there was a broad consensus understanding the need for additional measures.
Operator, can you please put through our next caller?
Vincent McDermott, Fort McMurray.
Hi, this is for the Premier and Minister Shandro. If we failed to drop COVID numbers fast enough, if there's even that remote chance of the scenario previously described to Rick Bell's question for the already exhausted and burnt out healthcare workers of this province, why has Alberta not requested additional help from other provinces and the Canadian forces, like what Ontario and Nova Scotia have done? Premier, as the former defense minister, isn't this exactly the kind of peacetime domestic crisis the military exists for?
As a former defense minister, I can tell you the Canadian Armed Forces does not exist to supplement provincial healthcare systems. Obviously, it can and does provide an emergency response function where absolutely necessary. We are able to manage the current strain with our current workforce, and that was not the case in Ontario, because when they went into the third wave, they were already very close to their peak in terms of ICU utilization, and that was not the case in Alberta. When we started this wave, our hospitalization and ICU numbers were far lower. I mean, today we have 150 COVID patients in ICU. We have defined as our maximum stretch capacity 425. So we have the capacity that we need, and we will not need to look at other measures if we can just bend the curve down and get it under control in the next couple of weeks. Yeah, and I'll invite Minister Shandro to add to that.
Thank you, Premier, and thank you, Vince, for the question. And I don't say any of this to take away from the dire need for and the urgency for the measures that were announced yesterday. But just to highlight again the work that we've done over the last 15 months to increase capacity in the healthcare system to plan for COVID. And that includes increasing the number of hospital beds that we have, as well as stretch capacity, and as well contingency plans on top of that. We have worked to increase our surgical capacity throughout COVID, unlike other provinces that some of them went down to 10% of their pre-COVID surgical capacity. I think on whole for the last calendar year of 2020, or actually the fiscal year, I should say, so going up to about March, we had 88% of our surgical capacity compared to the year before. Because of that increased capacity in our surgical system. And the ICUs as well. As Premier said, we had about 200 pre-COVID. We have increased those COVID or the ICU beds as well as the stretch capacity. Obviously, we still know and understand what that means to the workforce, which also the frontline clinical workforce we've added throughout COVID so that we had more contact tracers, more people immunizing, more people testing, more people in our ICUs. But we know that these numbers right now and the trajectory, as Premier said, is going to put strain on that system if we don't start taking steps now that were announced yesterday. So, but just for everyone to understand the work that was done in the last 15 months to increase that capacity and make sure that we were in a better position during COVID and throughout any waves that we would have seen throughout COVID. Thanks, Vince.
Do you have a follow-up question, Vince?
So I suppose this is for the Premier and Justice Minister. For months, we've seen people very publicly ignore existing restrictions and often in full view of police and bylaw officers, and nothing's done. This is going to be repeated a lot during the next few weeks as people test the limits of these restrictions and the promises made today that, hey, don't worry, the police are going to enforce this. These people, they clearly don't care about any fines. They don't care about a social media flogging from Twitter. And these interventions from the police that you described, Premier, they still didn't stop last weekend's rodeo from continuing. So what have law enforcement in this province actually been told to actually make sure that these restrictions are going to be enforced and not just against repeat offenders?
Well, okay, I'll take the first stab at that to say, again, that we as elected folks cannot direct operational decisions on individual cases by police or law enforcement agencies. We don't do that in a democratic society. What we do is to create policy and give enforcement agencies the tools. Minister Madu met with the main chiefs of police, commander of K Division for the RCMP earlier this week to see if they need additional tools or and part of what came out of that is this new protocol for greater cooperation between all of the relevant agencies, particularly to focus on serious repeat offenders of the public health measures. And we have brought to the attention of all of those agencies certain powers that already exist in the law that they can use in situations like last weekend's event, such as the Section 66(3) of the Public Health Act, which would allow agencies to apply to the courts for an order preventing events of that nature. So we have highlighted the availability of those tools. We've stepped up cooperation between all of the agencies. We've emphasized the importance of enforcement. And there has been enforcement. There have been thousands of tickets issued. You know very well about the situation around Grace Life Church in Edmonton. I think Alberta, those agencies have understandably tried to take a gradual approach to this, starting with education, then encouraging compliance more assertively, and then ultimately, if necessary, using enforcement. I think, so Minister Madu, would you like to add to that at all?
No, yes, thank you, Premier. And I think Premier have summed it well. Vince, listen, I hear your frustration. I am frustrated too. That in the midst of a public health emergency, a global pandemic, that there are Albertans, again, as I've said, a few, who, despite our plea to them to work with us to ensure compliance with the public health measures, have chosen not to. We have been patient. The law enforcement have the tools, as the Premier said. I met with them this week to specifically ask, what more would you require from us? And we had those deliberations, and I think that is the result of which is this new protocol that we have put in place, and the commitment to be more proactive across the province. So again, I would appeal to all Albertans, regardless of your view on the restrictions and on the pandemic, to understand that we are still a nation of laws. And we have put in place measures, legitimate measures, to protect all Albertans, because we are dealing with a public health emergency. And so from a law enforcement point of view, the chiefs understand, and Alberta Health Services understand that we would have to do more to be proactive, to make sure that as all of us collectively work harder one more time to get this pandemic behind us, that we have to all work together. And we can't afford to allow people out there to blatantly, create risk that prolongs this pandemic. We do not want to prolong this pandemic, and so I'm going to appeal to everyone out there to please heed the rules, work with law enforcement, work with Alberta Health Services so that we can get this behind us. But let me be clear, if there are people out there who are thinking of publicly and blatantly violating the rules going forward, there will be consequences.
We're just going to take one last question. I had hoped to take all the questions in the queue today, but we've already been at this for an hour, and we're now 25 minutes late for a cabinet meeting that I have to chair. So one last question, please.
Can you just put through our last caller, please?
Audrey Nouveau, Radio Canada.
Hi, Premier. Thank you for giving me the last question. I'd like to hear you in English and in French on that first question. You said you are looking at the total case count and the active cases for deciding when we could potentially lift the restrictions imposed yesterday. But the last time you presented a reopening plan, it was based on vaccination. And you said that most countries who are doing better are around 50% vaccination when their cases drop substantially. So is your vaccination plan still on the books, or will you tweak that? Will that be still useful for your decision in the next few weeks?
Oh, it will for sure. But Audrey, the last time we did a sort of reopening plan, it was called the Path Forward, introduced at the beginning of February, and it was pegged to hospitalization numbers, as you know. The immediate thing that we're looking at is growth in the cases, because it's from that we know how many folks are coming into our hospital system a couple of weeks later. But once we can see the numbers stabilize and start to come down, then yes, I think we can incorporate the growing vaccination into our policy framework, as Saskatchewan did yesterday. So right now, the immediate challenge, getting the case numbers down, moving that trend in the right direction, then we can focus increasingly on the vaccinations as a key metric. I'll try to say that in French. Maintenant, le truc essentiel, c'est de diminuer le nombre des cas, les croissances de virus en Alberta parce que ça, c'est une indication de pression sur le système de santé. Mais à la suite d'une diminution du nombre des cas, nous pouvons mettre l'accent sur le programme de vaccination, comme le Saskatchewan a fait dernièrement.
And I'd like to hear you in French.
Audrey, did you have a quick follow-up?
Yes, sorry. I'd just like to hear you in French again on the vaccination today. Monsieur le Premier ministre, vous êtes la première province à annoncer la vaccination pour les 12 ans et plus. Pourquoi l'annoncer aujourd'hui? Qu'est-ce qui vous permet de faire ça? Et est-ce que vous avez encore confiance dans le vaccin AstraZeneca pour les 30 ans et plus, étant donné la mort de cette Albertaine à la suite de son vaccin?
Évidemment, nous sommes attristés avec la mort d'une femme à la suite d'avoir pris le vaccin AstraZeneca, mais c'est clair quand même que les risques de COVID-19 sont beaucoup plus larges que les risques posés par n'importe quel vaccin. Alors, les vaccins sont sûrs, mais c'est triste que dans un très, très peu nombre des cas, il y a les résultats tragiques comme celle. Alors, cela étant dit, aujourd'hui, nous annonçons qu'à partir de lundi prochain, tous les Albertans de l'âge 30 et plus puissent enregistrer pour obtenir les vaccins. Ça veut dire que nous passons vers la phase 3 dans le programme de vaccination pour la population générale. C'est parce que nous sommes confiants que nous recevrons assez des doses du gouvernement fédéral pour élargir le programme de vaccination. Jusqu'à aujourd'hui, nous avons vacciné à peu près un tiers de la population totale, environ 40% de la population adulte des Albertains. Alors, nous faisons de progrès et nous espérons que dans le mois prochain, nous pouvons administrer un autre million de doses supplémentaires des vaccins avec cet élargissement des critères à partir de lundi prochain. Merci. Thank you very much, everyone.